Health Services and Transformation within the Department of Health, and also Michelle Essler, Head of Transformation Branch within the Department of Health. So we have obviously got your presentation. I'm happy to hand over to yourself for some brief opening remarks.
Thank you, Chair. Thanks for the opportunity to update the committee on the transformation agenda. As you know, the session was originally scheduled in June, and we issued a short briefing note at that time, and that focused on the 3-year plan and the hospital network consultation, and that information is still relevant, but I'll focus sort of my opening comments just on the main developments since then. So, as you will be aware, the Minister published his reset plan on the 9th of July, and that set out, built on the themes in the 3-year plan that was published in December last year, and that was to stabilise and reform the system as well as improve how services are delivered. And within the overarching themes, the reset plan focused on 7 key areas, and the first is prevention, and the second is investment in community care, primary care and social care, and the third is improving efficiency and effectiveness in delivery of services. The fourth is adopting a whole system approach to reducing unwarranted clinical variation. And then the fifth is maximising digital investment and the use of data. And the sixth, explore opportunities for research. And the seventh is creating an environment that supports system collaboration. A particular initiative to highlight is the commitment to develop a new neighbourhood model by March 2026. And the intention is to develop this in partnership with community pharmacy, GPs, voluntary and community sector, trusts, independent providers and local governments. So it's a whole system approach to that. Another development that's notable is the establishment by the trust of these new committees in common, and that is designed to facilitate shared decision making on issues that are best resolved jointly by the trust. So the matters to be resolved through that structure will be determined by the trust, but in discussion with the department. And aligned with that, the department has established a new senior leadership group, which includes the trust chief executives, PHA and BSO chief executives, as well as senior departmental officials and heads of professions. And this operates as with a one-theme efforts and oversees the reset agenda. So the reset plan also commits to the publication of a report on the hospital network consultation, and I'll just turn briefly to that next, Chair. So the consultation involved 9 separate events, and people and organisations could also complete the online questionnaire or submit standalone written responses. We received around 30,000 responses, so a really significant response to that, with the majority from the Save Our Acute Services campaign group, around 28,000 or nearly 28,000 responses. Responses originated from citizens, a range of organisations and campaign groups. So if you recall, the consultation questions themselves in that consultation focused on the hospital structure, the identified core services associated with that, and the proposed actions then to try and facilitate collaboration across the hospital sector. The themes in the response to the consultation were very broad and to a significant extent went quite beyond the narrow focus of the consultation document. But the main themes were, and there were 7 of them, the first is data and evidence to measure better outcomes. The second theme that came through was around equality and real needs impacts. The third theme was around workforce issues, leadership and collaboration across the system. The fourth was around involvement, engagement and consultation. The fifth was specifically about the proposed hospital types and the core services. The sixth that came through was around patient travel, both in an emergency and for elective care. And the final kind of major theme was a broad range of specific concerns about specific services. I suppose, pulling that together, many respondents expressed concern about potential loss of services or hospital closure. Also, a strong view that came through was that the decision-making process when making changes to hospital services is not very clear. And that local communities do not feel sufficiently involved in that process. And I think this is something both the department and the trust indeed will need to reflect on. So, Chair, that's all really I want to say by way of opening remarks. Happy to take any questions.
Okay, so there's an awful lot of important issues contained within this.